Hi everyone, my name is Dr. Kerry Brockberg. I'm a licensed psychologist in Edina, Minnesota. Currently, I work at a pain clinic working with folks with chronic pain, chronic illnesses, and chronic disabilities. But today I'll be putting on a different hat and talking about how mental health and musicians can be connected. So I'll be talking a little bit more about the neurobiology of stress and emotions in our body and in our minds. I'll also be talking about anxiety and stress and how that works in general with performance. And then in addition, I will talk about some tips and tricks to help you out with emotion regulation. Today's presentation is a psychoeducational presentation, so that means I'll be providing content. However, there will be no clinical dialogue occurring between myself and viewers. What I do encourage is if there's any mental health concerns that do come up for you during this presentation or that you're currently experiencing, to reach out to a mental health provider. I will be talking about how to do that in the presentation today. If there's a more immediate concern, like you have thoughts or plan to kill yourself or someone else, or if there's an abuse or neglect happening to a vulnerable population, like a child or an elderly individual, please reach out for immediate support by calling 911. Thank you so much for this opportunity today to share this information with you. And thank you for your participation and attention. As previously mentioned, today I'm going to be talking about stress and emotion regulation for musicians. Thank you so much for your attention, and we are going to get into our presentation today. So today's agenda today, we're going to start with an introduction to mental health and talk about the connection to musicians. Then we'll talk about the neurobiology of stress, discussing more of the mind and the body connection to stress and anxiety. Finally, next we'll talk about stress and performance, looking specifically at the anxiety stress bell curve. And finally, we'll talk about how to regulate one's emotions through quick and easy techniques. So to begin the presentation, I just want to talk about how mental health is a very typical thing for individuals to experience. I really liked this quote: "You can't calm the storm, so stop trying. What you can do is calm yourself. The storm will pass." A lot of times, folks that experience mental health, it kind of feels like a storm. It feels like there's a lot going on, and it's really difficult to calm down what's going on in our bodies and in our minds. Trying to find tools to do that can be really helpful. And another thing that's really important to know is that you're not alone in this situation. Plenty of folks experience issues with mental health, especially musicians. So I'm going to share some research with you that I found that will be particularly helpful. So the first piece of research I want to share is from Fishbane from 1988. This is an older article because it looks like it's a seminal article, meaning a really important article for musicians and the field of mental health. So this was actually one of the largest surveys that was completed with 2,212 musicians from 47 different American orchestras. So there are some limitations with that. This isn't going to be fully representative of all musicians, but it gives you an idea of what their demographics look like. So interesting enough, the article talked about how 76% of the musicians from the 2000 or around 2000 musicians endorsed issues that impaired their performance. So what that meant is that musicians, by taking the survey, said that there was some particular issue they were experiencing that impacted their ability to be involved in a musical performance. So some of the major areas that I clustered and the article talks about is musculoskeletal issues and mental health issues. musculoskeletal being issues with the neck, the shoulder, the back, and then mental health being depression, anxiety, and sleep related issues. I found the sleep related issues particularly interesting, thinking about the physical and mental drain that can have an impact on musicians, from the intricate movements that musicians make all the way to, the hyper focus that is required while playing and preparing and just engaging in music in general, especially with training and preparing for a performance. A more recent article, Mate et al., from 2018, describes some of the major areas for musicians that were really important to consider in connection to mental health. The first area is risk factors with performance related to musculoskeletal disorders. So, talking about issues with playing conditions, injury that can occur due to playing, posture, and level of fitness actually that is involved with being a part of music. The next area they talked about was music performance anxiety. There's another presentation in this festival that talks a lot more about that, so I won't be going too in depth of that for this presentation. But they just talked about how music performance anxiety can be impacted by level of experience, so the number of years someone has been playing, confidence or self-efficacy in their ability to play. Also, a gene environment interaction. So, there's what this is kind of referring to is some of the older ideas of maybe you heard from biology class, like the nature versus nurture. That idea has kind of been thrown out the window when we talk more about gene environment interaction now. So, talking about maybe even genetic or connections to anxiety and then environmental influences that can pop up that performance anxiety. In addition, thoughts, feelings, behaviors are other things that contribute to performance anxiety. What we think about certain things connected to performance, how we're feeling before, during, after performance, even training, and how that might impact our feelings. And finally, certain behaviors that might impact performance. This could be engaging in risky behaviors, such as drinking or using substances, performance enhancing substances. It just depends on the individual, but that all can impact performance. Also, a really interesting area was hearing loss. So, one thing they talked about was musicians can experience issues from sound exposure, surrounding instruments, and level of volume. Also, the frequency in which musicians are experiencing sounds that individuals that are not musicians, they just experience way more levels of volume that are connected to hearing loss. So that can be a major issue and impact mental health. And then finally, health related concerns. So this was kind of interesting and cool. They talked about more systemic and organizational issues that can impact health. So organizations like schools or communities, training programs, and they were discussing the importance of health and health education for musicians within the education that y'all receive while you are learning your instrument or in school to be a musician. So, just one final slide here for more general introduction and connection to musicians. I think that it's really important to understand, when do you reach out for help when you are experiencing feelings of anxiety or depression. And there's these are some cool pictures to think about. A lot of times, the picture that has all the questions, folks tend to ruminate or just think over and over again about different things and different stressors in life. A lot of uncertainty can play into our feelings of wellness. And those are times where you can reach out to a health professional, mental health professional, when you're feeling like you just need additional support. Other times folks reach out for support is when they want to gain more perspective. It's kind of like that third party view. So sometimes when you're in the trenches and experiencing feelings of anxiety or depression, um, it's really hard to take a more objective stance to what's going on. So, actually talking with someone that can come from a more objective standpoint can be really helpful. Also, I included this picture of Mr. Rogers. I recently watched A Beautiful Day in the Neighborhood that kind of talked about Mr. Rogers' life. Um, and there's this really cool scene that actually reminded me of this presentation, and it's when Mr. Rogers is putting together a tent, and the tent is really hard to put together from one person. And he looks at the camera and he says, I guess putting together a tent requires two adults. And I just thought that this was a really cool, vulnerable moment for Mr. Rogers to talk about how sometimes we think how things are going to go. We can plan it out in our mind and we think we can do it by ourselves. But sometimes we just need additional supports. And that's a lot about what reaching out for a psychologist or counselor can be about. There are different types of psychologists and counselors. So sometimes it's really about finding that match for you of who you feel connected to. I tell my own clients and patients that, if I'm not the right match, let's find you the right person. You're going to be able to open up a lot easier when you feel like you can trust that person. Also, I just wanted to talk about, and what I alluded to in the beginning of the presentation today, about how to reach out. So sometimes reaching out, we're like, how do you do that? So accessing therapy. Sometimes there's free counseling at universities, so reaching out to your own university if you are in school. Even if you're not in school, sometimes there are services at different colleges or universities to the surrounding public. So contacting a school or university for free counseling is actually pretty common. Of course, you can go through health insurance by looking up a counselor or psychologist that might be connected through your health insurance. I do recommend this because sometimes therapy can be expensive. So if your health insurance can cover, that is a great way to go about that. Also, sometimes through employment, there are opportunities called employee assistance programs. Essentially, this is free counseling that your place of employment has in place for you, where you get a certain amount of visits for free. Typically, it's like 6 to 9 sessions, and then you discontinue and go on with your health insurance. Something I did want to bring up today, if health insurance is not an option, there are therapists that do sliding scales for individuals. So out of pocket, going to meet with a therapist is another option. And therapists are, by their ethical code, they do work with clients, especially those that are really in need. So those are just some opportunities and things to think about. Next, I'll be talking about the neurobiology of stress, looking at the mind and body. So this is one of my favorite graphics to show my clients or patients because it's describing how stress and emotions work in our mind. This is kind of a simplistic graphic, but I think it's very helpful to kind of understand how emotions work in the mind. And I will be talking and trying to bridge this over to musicians specifically. So over to the right, you can see that there is a high emotion and then a picture of a brain. And I want you to pay attention to the middle part of the brain called the amygdala. So the amygdala is one of our emotion centers in our brain. It's kind of like the check engine light. It fires on when something's going on and it's really stressful for us. And the amygdala is actually very strong. So, what that means is sometimes when folks experience a high level of emotion, just like the little bar to the right, the amygdala can actually be so strong that it can take over our higher cortex, our frontal lobe, and can impact our decision making and our rational thinking. The interesting thing about this is that emotion can be positive or negative. So you'll notice at the bottom it can be anger, fear, excitement, love. Essentially what happens is that our amygdala can get so fired up that it can actually override that higher cortex. Other functions in the higher cortex are things like executive functioning, which is our sequencing and our organization of thoughts and actions. So, if you can imagine playing music and having this happen where our emotions get so revved up, something that you've practiced over and over again and you have this sequence to can be disrupted due to that high level of emotion. Um, so really important to think about our emotions, and when they get extremely elevated to the point of us not being able to access that part of our brain that has the rational thinking and decision making. Some examples might be maybe in the practice room if you're getting so upset because you can't get something, or if you're going for a performance. I was speaking with a musician and they told me that a lot of times string and piano players will do a lot of memorization of their pieces. And sometimes this can be really difficult when our emotions are so high and, is essentially taking over that part of our brain. So, in this presentation, we're going to be talking a lot about how do you lower down the emotions. To the left, the picture is showing that when the amygdala is calm and the level of emotion is lower, we are more calm and relaxed. And you can see that the higher cortex is not X'd out. And that means we can access those rational thinking and decision making, the executive functions. Organization of thoughts and behaviors in our brain. So, a lot of the times, folks, when we get really upset and nervous, we kind of freak out and we're like, how come I can't do the things that I've practiced over and over and over again? Well, the reason is because our emotions can be so strong that they can impact that. So, since we talked about the mind, and I will say that is just one piece of the mind. There's many things that go into emotions and how our brain is functioning. But I think that's a really helpful way to kind of understand how emotions and rational thinking and executive functions work. Another part that I wanted to bring up was more of the body connection. Of course, our mind is connected through our body, through the spinal cord. So really important to understand how the two connect with each other. So, the autonomic nervous system, or the ANS, is essentially the system that is letting our body know when we're stressed out or anxious. To the left, you can see the sympathetic nervous system. This is what kind of turns on when we are feeling overwhelmed, stressed out, or anxious. Over to the right is the parasympathetic response. So that's when we're feeling more relaxed and calm. So I wanted to point out a few things that I thought would be applicable to musicians. So over to the right, looking at the parasympathetic response. So this is when we're feeling relaxed. You can see at the top here that that's when our saliva is flowing. So thinking about a lot of instruments that require saliva and keeping your mouth wet. If you're relaxed, you're able to do that. But if you're more stressed out, that sympathetic response can fire on and we can have reduced saliva flow. In addition, so with when we're feeling relaxed, so that parasympathetic response will have a decreased heart rate, which is what our body is telling us you're feeling calm right now. In addition, you'll have the bronchoconstriction. So again, that feeling of relaxed lungs, able to go back and forth in a productive way. In addition, hormones and adrenaline, they're all firing at a consistent rate. Whereas if you're more stressed out, our body increases the heart rate. Vasoconstriction occurs. There's reduced secretion of hormones and increase glucose, which is like more sugars in the body. The body gets overwhelmed. This impacts the entire body. Hormones and adrenaline go crazy when we're in that stress zone. So it's really important to think about how all of these impact you all as musicians. So if the heart rate is increased, there might be an increased perception of anxiety at that time. Trembling hands, maybe you're gripping your musician or your instrument harder, which can impact our performance. When you think of lung capacity, even the ability to use your breath while you're playing can be vital in being effective in the performance. Playing together with others around you is really important as well, and taking those breaths. And if you're feeling stressed out, that can be a lot more difficult. This slide is just to give a little bit of information about how the body is really connected to the mind in that sense. And when we're more stressed out, and that sympathetic response goes on, we see a lot of impact on the body and in turn, maybe performance. The next section, we're going to talk about stress and performance, specifically looking at the anxiety stress bell curve. So the anxiety stress bell curve is one of my absolute favorite things to talk about with my patients and or clients. So what it really does is it talks about how stress and anxiety can impact performance. And I love the word performance. Typically I talk about this with like functionality and day-to-day activities of daily living, quality of life. But performance is such a beautiful word for musicians because we can literally take that as the performance that you are experiencing when you're playing your instrument, whether in training or in actual performance. So the anxiety stress bell curve comes from Yerkes and Dodson 1908 study, and there is a revision of that information from a Diamond et al. Study in 2007, but essentially talks about how stress and performance go hand in hand. So essentially what this graphic is showing is the bottom, the x-axis is signifying anxiety and stress. I've done a 0 to 10 scale here just for your own understanding of anxiety. And this is kind of an easy way to check in with yourself when you're feeling anxious or stressed. Whereas the y-axis is talking about performance. So the bottom being low performance, all the way up to the top being high performance, doing well, providing and producing quality outcomes in your music or functionality, however you want to view this graphic today. So essentially the idea with the anxiety stress bell curve is that we actually perform better under some stress. So you can see here I actually put some graphics and some understanding of everyone's anchor points. So if we were to put, smack dab in the middle of 0 and 10, we have 5 and go kind of a dash line all the way up to the top, we would see that a 5 is at peak performance. That would be if someone was, a 4 is their bottom anchor and the 6 was the top anchor. And those are anchor points that you can decide for yourself. The lower end is when you start to feel more anxious and you're getting into that optimal zone. Whereas the 6 and 7 end is when you start to feel too strong of anxiety and start getting in that danger zone. I like to show this to folks, this anxiety stress bell curve graphic, because it really takes away the idea that, anxiety needs to be omitted from our life. Some stress is actually good. We don't want to omit all of our stress because we know that folks that experience some stress, they tend to be the ones that care about their performances, care about their functionality. So some stress is actually a positive thing. I also put the anchor points because exploring what your anchor points are really important. Everyone's anchor points can be different depending on your level of stress and also your resiliency. It's important to understand how to recognize what your mind and body is doing and when you're starting to feel that stress, and then when that stress and anxiety gets to be too much. So, we're going to talk about how to do that in the next section of the presentation. And finally, what to do when you want to stay within these anchors. So if you start to feel yourself in this optimal level, how do you maintain that level of stress in that moment? How do you get your attention increased to be within the level of stress that is, helpful for your situation that you're in? And we'll talk about that in the next section as well. So the final part of the presentation is focusing on how to regulate your emotions. So taking in some quick, easy techniques and some things to think about. I want us to be thinking about how the neurobiology and the anxiety stress bell curve come together and inform, how we are paying attention to our mind and our body when it comes to stress and anxiety. So to begin with, I just want to start this part of the presentation with a couple things that are important to me. So what do Zumba, Bruno Mars, and my puppies Bella and Cody have to do with this presentation? Well, these are three things that help me regulate my emotions when I'm feeling stressed or anxious. So today in the rest of the presentation, I'm going to talk about how do we look at our anxiety and stress, and what do we do with it at that point. So I'm going to describe some how-tos for emotion regulation, starting with understanding awareness and understanding, looking at the importance of balance, looking at assertiveness, and then finally ending with some quick tips and a couple techniques. So, one of the first steps of understanding emotion regulation is actually kind of cranking up the knob of awareness and understanding. How do you know when you're stressed? So, I have some questions you can ask yourself. And even if you want to pause the presentation at this point and kind of reflect on this, that can be a great time to do that. But these are great questions, self reflective questions to help with your awareness of your stress and your anxiety. So, one of the first questions is, what changes do you see emotionally, physically, or mentally? So, emotionally can be like feelings that you have. Physically, maybe you notice changes in your body, you get more tired, or maybe you're not playing your instrument as well as you typically do. And mentally, maybe you're just drained. You're just exhausted and cannot pay attention or focus as well as you typically do. Another thing that can be helpful is understanding what changes you might see with your relationships around you. One of the classic examples of someone that's experiencing too much stress and anxiety is, they come home from work or school, and they take out their stress and anxiety on their partner. And relationships can have an impact on our quality of life, and in turn, how we're functioning, and maybe even how we're playing or performing our music. Finally, how does your work ethic or product look different? So sometimes awareness about our stress and anxiety can actually come out in our performance, or how we're engaging in different outcomes that we might be experiencing or connecting to. So even looking at if your product or your work ethic is changing. So one of the things that I talk about with a lot with my patients is when do we actually see these things? When do we stop and pay attention to what's going on with our mind or our body? And then really a lot of the times what we notice is that we're not experiencing or catching this stuff until it's too late. when we're really exhausted and we need to take a couple of days off, or just have a weekend to ourselves, or when, we actually physically get sick and can't even engage in, whatever we're trying to do. So we need to talk about how you can see them earlier. So the next slide, we'll talk a little bit about that. So how can you see them earlier? How do you see the signs earlier? So developing awareness and understanding, there's a couple of things that you can do to help with seeing and noticing the need for self-care. So the first thing is self-observation. So just taking the time to reflect. Some people journal, some people just jot down a few notes of how they're feeling. Referring back to that stress anxiety bell curve we talked about, even doing little anchor points like checking in with yourself throughout the day, before or after training, before or after performance. Scale of 1 to 10, how stressed out are you? If you're at that level where you're at a 7 and that's your anchor point where you're starting to get into the danger zone, it might be time to take a break. And on vice versa, if you're down at the 3 and you need to push yourself a little bit more, these are the things that we can do just through self-observation. Also, something that we can do is just talking about how monitoring can be really helpful. So, monitoring how we're feeling, what we're thinking, our emotions, our behaviors, to help gain in that control of our emotions in that moment. So, monitoring is, just checking in with yourself. It's again similar to self observation, but it's doing that over time. And just being fluid and gentle with yourself during those times. Identifying triggers can be really helpful too. Certain things can be, a trigger for us environmentally. Like we know that certain concert halls are going to be more difficult for us as musicians. We played there before, we have a connection. And knowing, okay, I'm going to get really anxious before this. How do I prepare for that? Some triggers are things that happen internally where we can't put our finger on it. So those things, just having a giant toolkit of things to do to help reduce the stress or anxiety in that moment, can be really helpful. Also, reaching out to an authority figure can be really helpful. So a private instructor, or even reaching out to people that you trust can be really beneficial. Sometimes that outside perspective can be really helpful in understanding how you're doing and what kind of self-care is needed in those moments. So the next part of the presentation connected to emotion regulation is talking about balance. I like to talk about why balance is important, and it really goes back to the idea of, and I like to sometimes show a tire when I'm talking about this on a car, or even this graphic itself, like the circle. But if one area of our life is kind of deflating or deflating on a tire, it's not that the tire won't keep going forward. Typically it does. But the problem is that the frame of the tire gets bent, and then, you have to replace the whole tire and the frame, and whew, it's expensive, right? So it's really important that balance, we're looking at all the parts of the tire, all the parts of our lives, and paying attention to them. So some things to think about and understand with balance. Just some things that might bring perspective to when we are not balanced. The first area to talk about is when we're off and thinking about our work or our music. So this might be like you're out to dinner with friends or family, and you just keep thinking about your performance, or what you need to be doing for your music or your work. That's not necessarily the time to be thinking about that stuff. And that's what we talk about or call our music and our work is seeping into our personal life. But on the other side of things, it also might be the opposite of that when we're at work or we're engaging in our music and we're thinking about our personal life. So you can see this flip-flop effect happening where, essentially in the setting that we're unable to be present with ourselves. And music is really about being present, right? As musicians, you probably have watched performances where you can just tell when the person is really engaged. And probably yourself been in a performance where you felt so engaged and present, versus those ones where maybe you didn't feel as engaged and present. And that's really hard to do if we're not feeling balanced. I will say, this flip flopping effect where you're thinking about work at home, or when you're at work, you're thinking about home, it actually might feel good at first. It might feel like you're working harder, like you're putting all your time and energy in thinking about your music, but the longer lasting effects are really dangerous. They can lead to burnout. So just thinking about that balance is so crucial. All the different things that we can look at to help balance. Some people look at and divide that up, like internal versus external things that you're doing in your life. Um, that might be related back to, like, feelings of relaxation and contentment, or what kind of things are you providing in your environment to make you feel less anxious or stressed. It might be dividing it up into actual areas of life, like the picture that is on the slide: social, physical, professional. That can be helpful for some people. And some people, it's actually just hours of commitment. So I was thinking about this for how it would impact musicians. And I was thinking to myself, even just the hours that are required for practicing and rehearsals, and then the actual performances themselves, the amount of schooling is just immense. So, even breaking down your week and seeing how much percentage you're giving to each area of your life, and especially music, can be really helpful in trying to recalibrate or rebalance that for yourself. So, talking about balance and recalibration, and what do you do from there? So, I like to bring up assertiveness during this time. And assertiveness can kind of be something that's interesting, especially for women, actually. Women, and when we are assertive, that can sometimes be misconstrued as being aggressive. And I want to kind of differentiate the two. Assertiveness is sticking up for your own boundaries and needs, in being respectful of others' boundaries and needs, but really making sure that you're being assertive in what is going to support a good mental health, a good quality of life. So, when you think about assertiveness, I actually want you to think about times where you can be assertive for your own self care. So, one of the first things that can be applicable in so many different situations is actually learning how to say no. So, saying no when you have too much to do is so important. I'll never forget, again, I had previously mentioned I'm not a musician myself, but when I first started my PhD program, gosh, many years ago at this point, that was one of the best things my advisor taught me. They taught me, this isn't about whether or not you can do something. A lot of times we can do something. You can take on that extra gig or rehearsal, or practice that extra hour. It's not about if you can, but it's actually a matter of, do you need to? Should you? Is your quality of life and your balance, your emotions, are you needing to in that moment? So sometimes we actually have to say no and give ourselves some space and boundaries. Protecting yourself and your values, there might be times where there's things and places or people you want to go and see. That's important. That's an important part of balancing and paying attention to our self care and our mental health. Also, communicating these boundaries with folks is really important. So, if you have a personal instructor, or your band or orchestra you're playing with, communicating when you're starting to feel stressed out, or when you need more support, is so important. Also, another area that can be really difficult for a lot of folks, and I was thinking about this especially with musicians, is relaying your information, the personal issues you might be having, and that how that can be impacting your performance. A lot of times this is a very scary, vulnerable thing to do, but it's really important because, communicating with an instructor or your group that you're playing with, um, can provide, some transparency of what's going on. It also can be a great jumping off or springboard to putting steps together or putting things in place to help support you and the wider group. That's so important, I think, while working and doing performances or music, is that a lot of times it's not just a single person. There are soloists, of course, but even then, typically you're engaged with an audience. So music is really about interconnectivity and how you're connecting to those around you. And an orchestra is a great example that one single performer is connected to this wider system. So if you're not doing well and that you're experiencing higher level of stress because of personal issues, that can impact the wider group. So having that communication is super important. So the question is, how do you be assertive? So some quick and easy tips to think about is, we don't want to get angry when we're trying to talk about how we're feeling and what's going on for us, although it can be really difficult, right? And going back to that neurobiology slide, when the emotions get high, sometimes we're maybe not thinking through the best way to communicate our emotions, our feelings. Those might be the times where you need to take a step back and relax and kind of calm down before you are communicating with others. But yeah, trying to remain calm in these times, and also just being mindful of how our language is when we are communicating how we're feeling. So generally using I statements can be really helpful. I think, I feel, I believe, I want. Those are really helpful in explaining what's going on for you in that moment. Another thing is our body language. How we're saying it in our nonverbals can be really helpful too. So, crossing our arms might be showing someone we're really closed off. Having sunglasses on when we're talking, or hiding our face when we're talking with our hands, those can be all things that show that we're scared or having a difficult time communicating. So having an open stance, using our nonverbals like our nodding, active listening, can all be really helpful. In addition, I just like to focus again and kind of reiterate the importance of assertiveness, which is, understanding that this is not just telling someone, okay, this is how I feel. You actually are being attentive to that person's needs and yourself. So I think an example of this might be, let's say a personal issue comes up, someone in your family passes away, you can't make a performance on Friday because you have to go to a funeral or a celebration of life. By sharing that information and saying what's going on with you, maybe next steps can be put in place for you to get a sub, or getting different supports to help with the performance so that can still go on. It shows that you're respecting your own needs of being with your family at that time, but also the needs of the wider orchestra itself. So these final slides are just some things to think about on what you can actually do. The cognitive triangle, this is a great way to kind of sum up different things that can impact our functioning. So our thoughts, feelings, behaviors. We've talked a lot about that throughout the presentation today. But yeah, those are just different things to come into understanding ourself and what we can do to help with our self-care. What are you thinking about? Negative thoughts are going to impact our feelings and make us feel more negative, and it's going to actually impact our behavior, our performance. If you're not doing well, and you're feeling kind of down, training or rehearsal that day might be a lot more difficult. You might not play as well. And then that might impact your thoughts like, oh gosh, I couldn't do this today. And that negative thinking can really have an impact on our overall functioning or connection to that session. Other things that you can do for self care, I really just emphasize the importance of having that giant toolbox of things that you can do. Some people like to tidy, get a hug, walk or go for a bike ride, enjoying sunshine or cooking. So it's kind of finding what works for you and your mental health and your feelings of stress. So, just a quick little technique to take away from today. One of the easiest things that you can do to help with your emotions and regulating it when you're feeling overwhelmed or stressed or anxious or depressed is to take a deep breath. So I really like this little graphic, and I put a little picture of the brain because I want us to realize again, all of these things that we're doing are to try to reduce that amygdala, to calm down that amygdala in our brain, to get over to that parasympathetic response, trying to get us into a relaxed state. And this will in turn help our functioning and our performance, our playing. So the deep breath is really nice. This little graphic, smell the flower and blow the pinwheel. So what we really want to do for a deep breath is to smell the flower. So breathe in through our nose and breathe out through our mouth, blow the pinwheel. Something that's really important is that we're always breathing in for less time than we're breathing out. So say you're smelling the flower for 3 seconds and blowing the pinwheel for 5. Over to the right, I actually included a few graphics for you because there are ways to get even deeper breaths. So if you go back to the slide, the neurobiology slide that talks about the vagal nerve or the vagus nerve, which is one of the longest nerves in our bodies, what we can actually do, and I learned this at a neuroscience conference I went to, and I just thought, wow, this is such an easy little trick for folks. Is actually just position our body in a way that can tap onto that vagus nerve. And the first one is kind of that lazy boy pose, the hands behind the head. That pushes down on the organs, touches that vagal nerve, and you can get an even deeper breath. The same thing goes for the superhero pose. So you can see Superman there. Some people call this power pose. Um, Again, it does the same thing, pushing down on that vagus nerve, vagal nerve. And then finally, one that you can do while you're sitting is actually put your hands underneath your legs. So that's what this woman is doing in this picture here. And again, it's that same concept of touching onto that nerve and taking that deep breath, smelling in through our nose, breathing in through our nose, and out through our mouth. So the last little tip and trick I want to give you is using your five senses. If you notice, the tips and tricks I gave you today are things that you can do anywhere, anytime. So our five senses, this is actually one that we underutilize on a daily basis. Um, Oftentimes our five senses are always triggering and are always on, but we're not paying attention to them. So if we actually turn up that, awareness knob and pay attention to our five senses, we can really get a lot out of it. So, five senses, things that we're seeing. So, this can be like watching a video or anything that makes us feel calm, like pictures. Hearing, this might be listening to our own favorite music or talking to a friend, things that make us calm down through listening. Taste can be, putting in a mint or eating our favorite lunch, drinking our favorite drink. For some musicians, this might be having your water next to you and having that taste to get you feel relaxed. And then touch. Touch is, essentially anything that we're feeling comfortable in. Some folks want to actually wear what they wear for a performance while they're rehearsing, or even opposite, maybe even getting your comfy clothes while you're rehearsing. So anything that is touching you that makes you feel calm and relaxed is really helpful. And finally, sense of smell. This is actually the strongest sense when it comes to emotion regulation and calming ourselves down. Sense of smell can be things easy as, smelling perfume, or putting it on a flavored chapstick where, you can smell it right underneath your nose. I know I personally like mint chapstick. That really calms me down. But anything that is related back to a sensory sense of smell that can calm down and make you feel more relaxed in those moments. So using the five senses can be a really valuable way of calming down your sensory system, and eliciting that parasympathetic response. So, some major takeaways today. This whole presentation was really trying to talk about stress and emotion regulation for musicians. I just wanted to give more of the neurobiology so you can understand how the mind and body connect to stress, and also just kind of normalizing some stress and anxiety in our lives and how that actually increases our performance. It's good to have some anxiety and stress. So our goal is not to omit stress, right? It's just how do we keep it within a realm that is helpful and functional for us. So the last little bit just talked about different tips and tricks of things to think about for your self-awareness, your balance, your assertiveness, in using some of the things that can help with emotion regulation. Um, I like to show these two graphics to my clients and my patients. The first one to the right, if you've ever been on an airplane before, they talk about, in case of a disaster, what do you do? And they talk about the air mask that will fall from the sky. And the one thing that they always say is to put the air mask on yourself before you put it on your child or anyone that you're assisting. And the reason being is because if we don't put the air mask on ourselves and we try to do this for someone else, we may not be able to do that properly. We lose our own oxygen, then how are we going to help someone else? I think this is actually a really interesting and cool idea connected back to being a musician within a wider group, whether that be an orchestra, a band, whatever that might be for you. But if we don't help ourselves individually as musicians, then how can we help the greater audience, the greater connection with the orchestra or band that you're in? So, really important that we pay attention to ourselves. Also, I just love this quote from RuPaul, which is, if you can't love yourself, how the hell can you love somebody else? Can I get an amen? Just kind of a fun little quote that RuPaul does, and explains that, taking the time for yourself is so important. So by doing this, sometimes folks think, oh gosh, there's such a time commitment in self-care. I think I hopefully gave some things today that don't require a lot of time, but by doing that, taking that moment, our quality of life, our functioning, our performance with our music is going to be that much better. So just wanted to give you guys those takeaways for today. This is just my reference slide. If you have any questions, you can feel free. I think a lot of this are available on Google Scholar, but there's just a few points. A lot of this was from my own clinical practice and training over the years, but this is just for you to have if you're interested in looking more at the content. Thank you so much for watching my presentation today. I had an amazing time putting this together, and I just really appreciate the opportunity to talk to you all, such a great group. And I feel so fortunate to have been able to find out a lot of this information and to share it with you. Wish you all the best, and thank you so much.